Hello, good evening, good day, good afternoon, wherever you are in the world. Thank you very much for joining the Black Belt Academy of Surgical Skills. I'm well aware of the news at the present of COVID in India and Brazil and other parts of the world, which seems to be running amok. I'm thinking of you, wish you well, and stay safe. My name is David O'Regan. I am a cardiac surgeon in Yorkshire in the United Kingdom. I'm also the director of the Faculty of Surgical Trainers for the Royal College of Surgeons of Edinburgh, and I am a visiting professor at Imperial College. If this is your first time to the Black Belt Academy, welcome. And if you are returning, as I know many of you are, thank you very much indeed. Surah, I have not received your video yet of your practice, and I would like to make a special mention because Surah sent me two fabulous videos of her practicing with forceps on new models, which I intend to post on the website. Tonight we're going to continue our story on how to use your needle properly and effect the perfect rotation. And in doing so, we must first begin to understand what is unique to us as humans is our function of the upper limb. That is pronation and supination. And the pronation and supination has effectively enabled us to use tools, to feed ourselves, and for personal hygiene. Altruistically, I would say it was to give and receive as well. So what I'd like to give to you this evening is some thoughts on how we use our needle holder to effect that perfect rotation of the needle. Because as we said last week, the needle has to be carried on the perfect circumference such that there's no space between the suture and the hole described by the needle going through the tissue. And if we're not clean with our rotation in and our rotation out, then we'll leave a space, as you can see there, that is a bleed or a microabscess. Now, we're all familiar with this. It's a screwdriver. And have you ever considered the screwdriver and the functional anatomy of the upper limb? Firstly, we put it in our hand and we use the screwdriver to repeat pronation, supination. And as you're doing that, do remind yourself the most powerful muscle for supination is your biceps. Your biceps starting from the long head, supraglenoid tubercle of the scapula, passing through the bicipital groove, and then joining in the upper arm, the short head, that arises from the coracoid process of the scapula. And this extends down the arm and sends into the lateral part of the posterior tubercle of the radius, and as that biceps aponeurosis that goes across the arm and sits into the deep fascia of the medial aspect. And what the bicep is doing is supinating the arm. And that makes sense, to be honest, for the design of a corkscrew, for tightening screws. You want to get the utmost movement and power in the forearm in that supination to unwind the forearm. So what I recommend to achieve perfect use of the instrument, I'm not advocating the use of the biceps in pronation, supination. I'm using this to demonstrate one thing and one thing only, is that the supination, I don't want biceps involved, but by holding it in the palm of my hand with my finger extended down the shaft of the screwdriver, I'm able to actually rotate the end of that without it actually circumscribing a hole. So you can hold it in a screw and twist it and keep it in the position on the spot. And therefore, in the same similar manner, I'd recommend that you use a needle holder. Needle holder is aligned just like your screwdriver along the axis of pronation and supination, which is between the index finger and the middle finger and the common flexor origin. Now, the other reason to do this is we need to rotate the needle. And I had a thought earlier on, and I'll demonstrate using a pencil being held by a needle holder. Now, let us put our fingers in the holes of the needle holder, and I'll hold it out to you, and I want you to observe, one, the end of the needle holder, and two, the degrees of movement of the pencil with my fingers in the needle. And I'm not going to cheat this. Let's see, I'm pronated and I'm supinating. I barely get. And if I start twisting my shoulder, I might go back and get further. But note two things. One, the movement of the pencil. But two, I hope you noted the end of the needle holder was rotating because its center of axis now is deviated because I'm holding the needle holder further out from the hand. By contrast, have a look at this needle holder now. I'm holding it a bit like a screwdriver. Okay, starting in a neutral position, I'm turning it up and turning it around. From there, all the way around there. I put it to you that I'm getting a better range of movement. And although you might not be convinced looking at the camera, my needle holder is not going round and round. There you go. From that position, all the way around to that position. So holding your needle holder along the line of axis of pronation supination is going to get you better rotation and constant rotation because the needle is not going to be moving round and round. But that does require a degree of skill. And the skill comes from putting your needle on the ratchet on and off. You can hear me doing that. And what I'm doing is actually using my opponent's pollicis to push it forward, or abductor pollicis to push it forward and unlock it and put it back on. It's a skill that takes a bit of practice, and I recommend that you take a needle holder, put it in your pocket, and walk around simply practicing this. If you have the advantage of bigger hands, it's easier, but it's not impossible. The other thing about doing this is I'm not gripping it. The needle holder is placed in my hand, and I'm using the palps of my fingers, index finger, thumb, middle finger, and my small finger to lightly hold it. And I'm lightly holding this and stitching. And that lightness and a feeling of the instrument enables you to feel the tissue. I recall doing an aortic valve replacement with a trainee who did a beautiful job and was closing the aorta. And again, the sutures and everything looked absolutely meticulous. But you can imagine my horror and his concern as we came off bypass and the blood pressure increased, the aorta began to unzip, which I found was incredulous because it looked so good. I suggested I came round and took over, and as soon as I put the first stitch in the aorta, I knew what the problem is. The problem is that my needle passed through the tissue like a hot knife going through butter. And I immediately knew this man had cystic medial necrosis, and before I could put any more stitches in, I needed Teflon on either side to hold it together. Now, what I didn't appreciate watching the trainee putting the sutures in, I didn't appreciate the feel of the tissue. And I'd suggest that putting your fingers through like that not only disrupts the motion of the needle holder, reduces the stability at the tip, but also attenuates the feel. Whereas lightly holding it in your palm, as I'm doing here, you can feel the lightness of that. Now, coming back to taking your needle through the tissue and the fact that we are operating at depth, and also suggest that from a posture point of view, that our arm is relaxed by our side, our elbows are slightly extended, and our wrists are palmar flexed. What's interesting by palmar flexing the wrist as well, you're actually removing the perfect position for using the long extensors and fingers and flexors of the fingers. So in this position, what I call a Thunderbirds puppets position, you are now focusing all your muscles and all your concentration on your hand. And the beauty about the upper limb and the evolution of the upper limb for humans is that the upper limb, with a combination of pronation and supination, and then abduction, adduction, extension, and flexion, which all make circumduction, together with the fact that the scapula moves over the chest, enables you, as you know, with a screwdriver, to get in to every single position. That is, putting a flat pack together and under the sink or fixing a car, your arm and position can always get your hand into the perfect position to enact that movement. And this is what stitching is about, is realizing that we need to get our upper limb and hand into the perfect position so we can use it with the gentlest of touch and caress the tissues. So I just want to take you to the overhead camera to reinforce a couple of things. We described last week, as we said, the needle needs to be taken through cleanly, and I demonstrated that all these needles need to be aligned 90 degrees across the tissue, 90 degrees into the tissue, and 90 degrees being the perfect orthogonal plane. When we actually practice at depth, we also described the needle needs to be adjusted accordingly for the depth or the time. Now, we said pick it up just beyond halfway, pick it up so there's no space between the tip and the shaft, and angle it out because that's the angle between the horizontal and the forearm that enables you to put your needle down in 90 degrees in all three orthogonal planes. Well, that is absolutely fine while you're stitching on an anterior surface of this potato and taking the needle through and taking the needle out. And I've missed the horizontal there, but the tissue is holding it for me to pick up, and I pick it up again. Now, the great thing about the potato is now you need to think how I'm going to stitch on this side, this side, this side, and this side. And this is where your upper limb and understanding how to use your upper limb and shoulder and circumduction to get into these positions. The alignment of the needle itself is always the same. So what I'm going to do is the most difficult position and exaggerated position is what I call the angle of sorrow in a cardiac surgery. This would be down between the sinoatrial node, the roof of the left atrium, and the right-hand side of my aortotomy. And it is in this angle that most of the bleeding occurs. But we need to angle our needle. Remember, 90 degrees in all the planes, I've marked it there. But to get my needle in that position, I have abducted my shoulder to bring my forearm up so my elbow is almost perpendicularly in the air. And you can imagine that is very similar to the position that you use with a screwdriver. And I take it in and out of the tissue. And I've got to do it gently because, as you can see, if I pull it hard, I get it wrong. What I'm having to do is work around the light at the moment, but I'm not going to excuse poor technique, and I'm going to practice further. So there you go, line the needle up. At that, I've abducted my shoulder and lining it up and taking it around and taking it through. And you can see I haven't got my shoulder perpendicularly up because I'm looking down through the camera and you're looking at the camera, and you can see how beautiful this model is in tearing the potato. Do it without the camera. So how do you combine these actions of pronation, supination? Now, we said place it 90 degrees across what you want to stitch and put it 90 degrees into what you want to stitch. Now, as I come to this backswing, to bring the needle 90 degrees into the tissue, what I'm doing in that pronation, I am using my abductor pollicis to unlock the needle. There you go. I'm going to unlock the needle. I'm still holding the needle unlocked, and I'm going to take it through the tissue and let the needle do the work. Again, I'm having a bad evening, aren't I, folks? I've actually mashed the potato. There you go. So even for expert surgeons and trying to think, maybe I should turn the light on, it is actually proving a challenge. But this is why the potato is actually a wonderful stitch. So I've unlocked it and take it back. For fine sutures and fine needles, we employ the lumbricals and the beautiful needle holders called Kasayevas. Now, the use of this needle holder, again, is rotation. But are you familiar with the way I'm holding this? You're right. I'm holding it much the same way as I'm holding forceps. I'm employing my lumbricals. And you see that this instrument has a barrel. And essentially, what I'm doing is much the same as I do if I roll a pencil. Yep. Simply rolling the pencil. And when using fine needles, that's exactly what I'm doing. And the model that we used in it, remember, is my poached egg. This is part of the suite of splash models. So I'm going to make a little arteriotomy in the membrane over this. And again, a bit like the potato skin, my rotation of the needle through the tissue is going to be dependent on how well I rotate. So I'm going to place my needle across what I want to stitch. I'm going to rotate it back. But remember, when I'm rotating it back, on the large needle, I've unlocked it. In the same way, with this has got a ratchet on, and some surgeons don't have ratchets for this reason. It's at this point that I recommend you unlock the needle, because if you wait until you take the needle through the tissue to unlock it, it's very likely that the movement of unlocking, I noted before, is an involuntary dropping of the arm. And you can imagine if I make an involuntary movement on this poached egg, then I have a problem. The angle of the needle each and every time, to reiterate, needs to be the same. No space between the tip, just beyond the halfway, and angled out because it again applies to the angle between the horizontal and forearm. My colleague did say it's much better with the light off. So I'm going to turn the light off so you can see the needle. And I might in fact turn the main light off so you can see the needle clearly. You can see it at the tip there. And I'm actually lifting it up, using the needle to remember, lift the edge out and let the needle do the work for me in delivering it. There you go, and out. And I'll put the light back on. So really what we're doing in stitching is paying attention to the way we take the needle through the tissue and we're rotating. And I hope that you are convinced, and I'll show you one more time, that finger through the instrument, and fingers not through the instrument, I hope that you see there's a greater range of movement and greater stability. The other advantage, of course, of holding the instrument in the palm of your hand is very simply, if you want your needle holder, the surgical scrub nurse pops it in your hand. You don't have to disengage your fingers to put it down. You can pass it to the nurse, pick it up, pass it, and there's no extra movement. And it makes it easier to pass and use your needle holder. I hope this makes sense to you. We are going to continue our stitching story as part 3 to wrap it all up next week. We'll come back to our banana and ask you to practice on your banana and practice the rotation, remembering the angles, remembering pronation, supination, remembering clean entry, clean exit. And it's all about the setup, and it's all about how you hold your upper limb. The human forearm and development and evolution of that is fantastic. It enables me to put my palms together and say, thank you very much indeed for joining the Black Belt Academy of Surgical Skills this evening, and I look forward to seeing you next week. Stay safe and be well. And thank you very much for your support. Please put comments in and please send me pictures of your practice at home. Stay safe and be well.